This video is an introduction to the basic self-care of shoulders. There are two common presentations of shoulder dysfunction that come into my clinic. And the first is a general restriction of the shoulders because the shoulders are rolled too far forwards. And the second common presentation is a limitation and a pinching or a clunking that goes when the shoulders are moving around. This form of impingement or entrapment can be quite complex, but there's a couple of basics that can help with maintaining that. As for the shoulders being too far forward, this often happens because the muscles down the front are too tight. If they pull you forward, this can be fighting with computers, the world, even doing knitting or playing on tablets too much. So what we can do with that is we can look to open up the chest and make the shoulders more square. Now this is going to have a limit because some people have various levels of curve through the upper back, and that tends to roll the shoulders forward. There may be some genetic features, there may be some habit features, there may be some injury features. So it's always worth getting a good assessment done with a skilled osteopath to see what's going on. There's a large number of exercises that tend to open up the front of the chest. And one of the most common ones is to pull the shoulders down and back. Now you might notice something sticking out the front here, so suck it in a bit. Get your core organised and then push down and back. And that gives a really nice tight opening up through the top of the back. Actually any exercise that pulls the shoulders down and back, whether it's like this, is actually quite good for the upper chest, to open up the chest, to bring the shoulders back as far as they will comfortably. Now when pulling back, we're trying to pull the shoulder blades back together, And we want the tension point at the lower part of the shoulder blades, pulling down and back, down and back, down and back. There's a couple of other easy exercises for this to do at home. Is, say, the doorway stretch. Put your hands up on a door frame and push yourself forward. But the trick of this is to organise your core when you're doing it. So put your hands up on the door frame. Organise your core, flatten your tummy, tuck your tail under, and push through as one whole body. And this gives a much broader stretch. The common bad habit way is just to push your head forward, and that's not nearly as significant a stretch. If you get yourself organised and slide forward as one whole body, it just makes the exercise a lot easier and a lot more productive. You can use the top of the door frame. The reason why it's important to open the chest up is to allow your shoulders to sit squarely on your rib cage. They sit back, they rest nice and secure on the rib cage, they rest there. If they roll forward, they're tight, they're pulling forward, and it sets up a whole lot of limitations in your shoulder movement. So you can explore this yourself. If you let your shoulders roll forward and try and lift your arm up to the side, and it gets limited quite early. If your shoulder blades are nice and square and your tummy tucked in, there's a freedom to move your arm up much more easily. So you will get better movement out of your shoulder joints by having your shoulders square on top of your thorax or your chest, as much as you're able to. And with the shoulders forward, you often get this really tight, gnarly pain down the front of the chest. So do work on that. It is the most common sort of limitation to shoulders, and it also sets up a whole lot of trauma and degeneration or dysfunction in the shoulders. Now, the reason why you can't lift your arm up cleanly when it's rotated forward is that the arm, this here, sits inside a shoulder in a little cup. And what happens is when you lift your arm up to the side, it first slides down and then around. Lifting your arm up, it first slides down a little bit and around. If your arm is too far forward, it goes up and can't tilt enough to get past a particular bony section called the acromion on the top of the shoulder. So it just gets stuck. And so if you bring your shoulders back, you get a much better range, you get much healthier movement in your shoulders. And whatever shoulder complaint you may have, it is likely that this is going to be a really valuable exercise. And it's worth paying attention to, because we tend to roll forward and get stuck doing things. The second one that happens, and is often the consequence of this, you get a little bit of a shoulder impingement. As your arm lifts up, it goes clunk. It goes up pinching. And this is often, the impingement is often a difficult story to get around to people. Often when you're lifting your arm up, you get this pinching, or sometimes moving around, you get a clunk, and this is the arm joint rolling around over top of a tendon. There's other things as well, but that's the most common one. And with that, clunking occasionally is all right, but don't assume that you can carry on clunking it and make the trouble go away. It just goes and mushes up the tendon, and that's not really a good thing to do. So whatever you got, try and bring your shoulders back. Now, how do you correct for these things, this muscle imbalance in the shoulders? Now, there's a lot of really good and clever exercises out there in the world. But the most common one is still the most effective, is to have your hands, elbows, the side of your body, and rotate your hands, arms outwards, so that your hands separate out the front. You can do this with a TheraBand. You can even do it side on with a little weight, and that balances out the muscles, making these ones at the back a little bit stronger, and there's some muscles right inside, and that will be stretching those ones open. So spend a little time doing that. And that will often open up the deep muscles inside the shoulder and the rotator cuff section. So if you are planning to do some other exercises for your shoulder, just make sure that they're not hurting. If you're trying to do an exercise and there's an impingement or a catch or a strain or a pain, it's worth getting a proper assessment to see what's going on and to see how you can modify these exercises. So, just to recap, the fundamental problem is shoulders rolled forward. Open up your chest. Make the muscles at the back a little bit stronger. Make these muscles in the front a little bit easier. so that when you actually lift your arm around, you have a good movement in your shoulders. And the key exercises for those clunky tendons is to stretch open in an exercise like this, with your elbow on your side. This stretches some of the deep muscles inside your shoulder blades. And there are plenty more clever and more advanced exercises you can do. So take with that, explore what your experience is, and come in and get a full assessment, and you may find I'll be giving you these exercises as well to complement others.